The General Hospital recorded a busy carnival season due to an increase in accidents and violent incidents. So says Dr. Taisha Donnell, medical director and pediatrician at the General Hospital.
So this carnival season, what I would say is that we did have quite a few incidents in motor vehicular accidents. We had some choppings, we had gunshot wounds. So we had a very active season. Of course, our accident and emergency team, we were able to step up on our staffing, our physician staff. We were able to, of course, step up on making sure that all of our necessary, all the necessary elements needed to be able to, deal with these emergencies were in place. Of course, you assisted us in doing the blood drive because, of course, with all of these accidents and choppings and so, it's important to have blood to take care of some of these patients.
She said while the staff was active, they were not overwhelmed.
But we were able to deal with them. We were very active, but I won't say we were overwhelmed, but we were very much active. Our staff was able to manage all of the cases. We had a lot of orthopedic cases as well, so a lot of fractures and, from the accidents and choppings and so.
Dr. Donald added that in the midst of the accidents and violent incidents, there was an uptick in chronic illnesses.
In general, the whole hospital was busy because, of course, you also have, because of the festivities, persons, of course, you're eating more fried chicken, more oil down, and so the blood pressures and the blood sugars were all up. So we had a lot of persons being admitted also for the chronic diseases, uncontrolled chronic illnesses due to the change in diet around the festivities.
People putting medication on hold to indulge in festivities were also the subject of a discussion highlighted during government's next chapter on Monday. Dr. Donald said this has serious implications for the health of the individual. She provided advice to those battling health challenges such as chronic disease.
Good. So a person develops a little cut, they get an infection, and they have to take antibiotics. They're also hypertensive, right? And this is carnival time, they want to go out, they want to fete, they want to have a good time. So, and of course for them, having a good time entails drinking. I mean, having a good time does not necessarily mean you have to drink. So they stop the antibiotic one, and then of course they're drinking drinks that would raise your blood pressure. So they end up with high blood pressure and an infected wound, all because they want to fete, right? Now this is a very serious thing. Now, I would say, if you want to go out, you want to have a good time, nobody has to know what's in your glass. You could have a glass of orange juice. Nobody would know if it has anything in it or not.